and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. And before we bring on our amazing guest for today's episode, just wanted to quickly remind everyone that we have our big summit at the end of the month. So it's from November 29 to December 1st. The information to register is in the chat, and there's also a promo code available to get 25% off of a ticket. So please register. It's going to be an awesome event. And we also have our Breakthrough One membership. That window is open for membership. So if you are interested, all of that information is also going to be in the chat. Another really awesome program. And here's also a little bit more information about the types of things that you'll be able to get access through the Breakthrough One. And so with that, want to bring on our amazing guest, Marissa Fayer, who is the CEO and founder of HERhealthEQ. As you know, we love questions here on Women's Health Tech Wednesday. So if you have any for Marissa during our conversation, please add them to the Q&A feature at the bottom of your screen, and I will make sure that we get to it. And so with that, welcome, Marissa. So happy to have you on.
Hey, Nina. So great to be here. Thanks for having me.
Yeah, absolutely. So of course, this being a Women's Health Tech webinar, the first question that I have to ask you is, what does Women's Health Tech mean to you?
Yeah, so I mean, it means solutions and innovation for over 50% of the population. I mean, 51% of the population globally is women, and it means innovation for the rest of the world. And it, with tech and health tech, and especially for women, it means that there's solutions that are relevant, and also that they're inclusive of all people. So there could be health tech that's for all people, but it also has to include women. And right. So to me, that's what it means. It's innovation for everybody. Absolutely.
I love that. I love that by innovating for everyone and innovating for women, those two do go hand in hand. So I love that definition. And so, would love if we could maybe kind of kick off our conversation, just being able to learn a little bit more about you. Would love if you could tell us about yourself, your background, and really the journey that led to you creating this amazing company.
Yeah, for sure. So I've been in the medical device industry for 22 years. I'm an engineer by background. I have an MBA as well. And I spent 9 of those years at Hologic, the largest women's health company in the world. And I always had a passion for women in STEM and, but I was never an educator. And then I realized, oh, there's this whole thing called women's health. And so, before it was a trend, I was certainly working in it. I mean, very, very early in my career. Mm-hmm. And I was fortunate to be on the development team and the operations team to roll out the first 3D mammography system. And then I was handling a lot of mergers and acquisitions. And in one of those acquisitions, I actually moved to Costa Rica with the company. And so it was great doing work there. And then, the famous story is I had a conversation at a bar with a friend of mine, and the idea for HERhealthEQ was created. And it was just, she was telling me that women in developing countries, and especially Costa Rica, which we were in, women were dying of breast cancer. And it was because their mammogram machine broke down, which I thought was obviously preposterous because I just finished launching the 3D mammography machines, knowing that the 2D machines were coming back, as trade-ins, and they were lined up against the wall. And there were so many of them, we didn't know what to do with them. And so I was like, great, we should donate one. And, 2 years later, we finally made that happen. And the idea just kind of stuck in my mind. And I kept thinking okay, great. So there's corporations and hospitals that have excess equipment. They trade them in every few years. And that's wasteful from a sustainability perspective. That's wasteful because there's people around the world that don't have this equipment. So why not get them to where they need to go? And my focus has always been on women. And then, through a lot of research, I realized that girls weren't going to school because their mothers, their grandmothers, their aunts, their sisters, they were falling ill. And so they were being pulled out of school. And so I'm not an educator. It's not a school. It's not you have to build more schools. It's more girls needed to make sure that they stayed in school, and girls are always the first ones pulled out of school versus a boy. And so I thought hey, I'm in healthcare. I can solve that problem.
Yeah.
And, trying to solve the sustainability side of things, trying to, get equipment where it needs to go, and making sure, girls were staying in school, like that's important. And so, so that's how HERhealthEQ started.
Wow.
Which is really exciting. And we're in 9 countries. Currently, we're doing a massive expansion right now. Obviously, took a bit of a pause for the pandemic. And we focused on non-communicable diseases because that's where medical equipment and not supplies, but medical equipment can really diagnose, prevent, and treat a lot of these NCDs. And there's so many countries and regions that are coming up, like, continuing to develop, which is incredible. But now everyone's living longer, and it's like, oh, hi, you now have cancer, or you have diabetes, or you have heart disease. And so, like, digital health and health tech is great, but like, you sometimes also need physical pieces of equipment. And listen, it points back to a sustainability issue that like all of us are really focused on, in this world, and should be. So HERhealthEQ's there.
I love that. I mean, just the sustainability in and of itself, I think, is such an amazing mission. But I love that even as you were explaining kind of your story and what you're seeing is just another reminder that, health is all encompassing, and, not having healthy outcomes like you kind of saw with an education perspective, but there's so many other factors that it impacts when your support system, your family is going through health difficulties. So I just love that you are kind of thinking about it also in that holistic manner. I think that is absolutely incredible.
Thanks. Yeah. I mean, listen, like, health is not inclusive to just the one person going through it.
Right.
And it's actually, poor health is not inclusive of just the one person. It brings an entire family. It brings in communities. I mean, like, that's one of the few things actually that we've seen as a benefit come out of COVID-19, is that, like, you see that it's an entire family that gets affected. It's an entire, community that rallies around. Like,
Absolutely.
This is an entire ecosystem. It's not just the one person who gets sick. And that's the same thing with women. The unfortunate part and the fortunate part of women being who we are, we are the ones that support communities. We're the ones that, support our families. We're the ones that, work together. And when there's a break in that system because of health, like, everybody else has to rally around. So, our intent is to really keep these, keep communities intact.
Absolutely.
Like, listen, we'd love to put ourselves out of a job one day. Like, that is the ultimate goal.
I love that. And I think this really speaks to just the broader, I think, mission, right? Like, it's, just with the work that you're doing, really prioritizing equity, being able to, provide these resources, provide the equipment. Would love to kind of just learn, what is kind of your ultimate goal, or like your North Star in mind when it comes to this amazing work that you're doing?
Yeah. So the big overarching goal is equity and equality. So without equity, you can't have equality. Right. And so, like, that's our overarching, it's even in our name. So EQ in our name means equipment for equity. And yeah, like, because it's so important to who we are. I mean, that's our overarching goal. Our short-term goal is we're planning to affect 1 million women by the end of 2025. And we're actually on track to quite exceed that. So we're really excited about it. But, like, equity and equality as an overarching goal, means that, again, technology has to be available. It needs to be relevant. Like, as I said, like, love to put ourselves out of a job, because I'd love companies to create these programs and, systems that they can do it themselves. And some have started to do that, and it's incredible, which is fine. And we fully support. There's a lot of them that don't. There's a lot of them that don't want to put this work in. There's a lot of, organizations that, like our fancy hospitals, it's non-value added, like, capital wise and revenue wise work for them.
Right.
But that's why we're great partners, because we're able to partner with them so that they can get those, ESG metrics and DEI, and they can check the boxes and sustainability. And we're happy to do that because, and eventually all these countries will have all their money and they'll be able to purchase all this equipment. Like, we're not in the, in the business of making a ton of money, sustainability money, to support ourselves, of course, but, like, This is not like a get rich and sell this company, and it's not a unicorn. We're
Right.
nonprofit, we're a social enterprise. Like we want to do the work and to do the good. And that's, really focused on equity and equality.
That is absolutely incredible. And also curious, you kind of mentioned, how you partner with whether it's different hospital systems, manufacturing companies, et cetera. Kind of how does that like process work? Is it kind of like a matching where you match, hospitals that have X equipment versus with community health clinics in other countries that have lack of this equipment? Like, how does that kind of work?
Yeah, we're kind of like this intermediary in the middle, and nobody knows about each other. And so, we also, we either create programs where we say, hey, we're focused on maternal health, so we need X number of ultrasounds to tackle this. And, then we go out to other, countries and communities and work with partners that are local on the ground. So one of our biggest tenets is that we individually as HERhealthEQ will not put our teams on the ground, because there's already organizations, there's already clinics, there's already doctors and nurses that are already there. Like, we don't want to be taking the jobs from anybody in a local community. That's not our intent. We actually want to create more jobs and more opportunity by getting them the equipment that they need to do their jobs. Right. So, and also it's the other side of like the hospital systems and medical device companies. This is not revenue impactful for them. So a lot of them have their CSR teams and ESG teams and all of these things, and they want to create something. It sometimes becomes very political and it just becomes a bigger process, and they don't want to necessarily do it. So here's where, that's our intent is almost to be the bridge in the middle. And, so sometimes we create programs, sometimes we just have people reach out, or we reach out to them to say, hey, what do you have in your supply chain? And, and then we have the equipment and we get it to where it needs to go. So that's kind of our plan.
That's incredible. And so I remember, and I know one of the projects or kind of work that you were doing just this past month for breast cancer awareness. And I know that you were doing a lot just to promote, preventative screenings. And I would imagine that really hit home just based off of, how mammograms and all of that work was kind of the catalyst for a lot of this. Would love to kind of learn from you, what are some other like health conditions or, areas of women's health that are typically overlooked that, really need some more visibility or attention on?
Absolutely. So heart disease and cardiac issues, like literally top of the list, diabetes and maternal health. So ironically, heart disease is literally like top of the list that affects women, and people don't kind of realize it. Women present differently than men. We're often diagnosed or misdiagnosed. So we're diagnosed late or misdiagnosed. And it's not something like, women don't present like clutching their chest with a heart attack. We present with stomach issues and a little bit of tingling, and our back hurts, and that it's different. So, so it's unfortunately like it's a massive silent killer. Yeah. And so that's one of the things. So heart disease and cardiac issues, diabetes. So as everyone around the world is having access to processed food and some more chemicals, diabetes is really on the rise. And again, this used to be called, a wealthy country problem. It's no longer a wealthy country problem. It's an everybody problem. And maternal health is always an issue. There's still issues globally around the world. There's not enough, care necessarily being had. And I mean, we can see it in our own country. Where actually maternal mortality rates are increasing, the only developed country in the world where this is happening. And so those are the three really big areas besides, cancers that affect women, such as breast cancer, cervical cancer, ovarian cancer, lung cancer, stomach cancer. Those are some other areas that really need to be focused on and need to be studied as well. So there needs to be like a lot of studies that include women.
Yeah, that's amazing. And my mind just keeps going back to what you were saying about heart disease, because, at least for me, that presentation that you were talking about of like clutching your chest and like having this big, like, that's my perception of what it means to have heart disease or to have a heart attack. And I'm so curious, like, do you have more like information? Like, how is heart disease or how is this impacting women? And, just would love to learn more, because that blew me away.
Yeah, so I have some stats that I'm going to read up, kind of,
Yeah.
just to have them, because you can't memorize everything.
Yes.
So heart disease is globally in women, has the highest mortality rate.
Wow.
It's in the highest years of disability, and it is the largest contributor to loss of potential life, like of years lost, across all of the NCDs. So literally ranks highest on every list. It greatest affects women and families, because oftentimes, if you're in heart failure, it takes a long time. So like your performance is not, as high, whether you're working in the market or, you're working with your family, like you're out of breath more often, you're not, necessarily, going to the market, you're not able to, support your kids or walk them to school and all of these things. And so, and it kind of comes on, and it creates so many other health issues that, which is one of the reasons why it's like the silent killer. It's not like, with a man, like most of the time you're clutching your chest, and that does happen with women, certainly. I'm not saying that it doesn't, but it less often happens, or, and the part of, they don't take, women don't get diagnosed with heart disease. Like this is even like literally in our own country here.
Wow.
So it's, with the stomach ache and a little bit of pain and, sometimes some backache. Well, I mean, that could be about 14 different things. Like, I feel like I have that every day,
Right.
so, and I know I don't, thankfully have heart disease, but, it's one of those, like, because it's masked and so different in women, people just don't think to like say like that's the first indication, like this, oh my God, like that gets you to the emergency room. And so I think like that's really important, for us to think about.
Yeah, that's so interesting. And like you contextualize it really well about like, this is kind of how it exists just within the spectrum of, living your life as a woman, just what you have to go through as you're just trying to receive care in general. I think you painted a very good picture. And I'm like, that's a good stat for me to now have in the back of my mind, really.
It's scary. I just recently found it out. Like I knew it was in the top 5, but I really didn't realize it was number 1.
Yeah, that is really, really surprising. And, I just, as you're kind of talking about this, and I think just during the conversation in general, with the work that you're doing, you have such a unique, like global lens when it comes to women's health. Would love if you could just, share, some of the insight that you may have, like being able to kind of see things on this global level, and, what are some next steps that we need to collectively take to promote, health globally, or just global health in general.
Yeah. I mean, thank God for the internet and everyone talking. And I mean, that really does help. But I also think we need to talk about it. Like, let's talk about women's health. Like, obviously we are, and people I surround myself, and I think there's a little bit more of a conversation, but like, you talk about it so that innovation can happen around it. So we're finally talking about menopause. Like, my mother didn't talk about menopause. Like, I didn't know she was going through menopause. I mean, like I knew something was off, but like, I didn't know. And, talk about it so that we can innovate solutions for it. Like, talk about heart disease. Let's talk about, cervical cancer. Like, it's a virus that creates cervical cancer, that anybody can get at any time in their life. So I also, like there shouldn't be stigma around these things. Like, we need to talk about it. We need to include women in trials, in medical device and pharma trials, like in all types of trials, so that we know what's best for them. So, dosing is also different when a woman has a disease versus a man. We need to innovate. We need to design with women in mind, or how about we also have women in the design cycle, so that they're innovating and they're included in these ideas. And, we need to include women in management, women on boards, like, the very traditional and typical, but these companies aren't going to grow if you don't have women. And there's tons of studies that have been shown that companies perform significantly higher when you have women in management and women on boards. So I don't know, from a company perspective, like it just makes sense anyway. And a financial performance, like, why would you not? And then that trickles down to the entire rest of the organization. So, what can we do? And we need to fight for it. We need to talk about it. We need to make sure that there's, safe and equitable access to care for literally everybody every population. And those are things that we can do locally and globally.
I 100%. And I love that you're kind of thinking like, how do we just permeate spaces and make sure that at every single level that healthcare is being discussed, designed, developed, that there is a perspective, that there is a seat at a table that is given to women so that this can become so much more normalized and not like this niche topic issue.
Right. I mean, it's not niche. It's 51% of the population.
That's
Like
right.
we're like, we're actually, we should call men niche.
That's
I mean,
right.
you know, like
Absolutely.
it is not a niche like area. We're not calling climate change and climate tech like a niche market.
Right. Like a special interest. Like,
here.
yeah, absolutely. 100%. Yeah, this is not like a buzzword or anything like that. Like this is
right.
More than half of the global population.
Right. We're not talking about something that affects like literally 4 people in this world.
Right.
Like this affects the entire half of the world.
Absolutely.
Yeah,
absolutely. And
yeah,
I think
that's why I hate the word niche.
Yeah,
I do.
No, I agree with you. And it's just always so ridiculous to me that is how women's health, femtech, like how it's always kind of classified as like this special, like niche, you know, micro-focused group when it absolutely isn't. The things that a lot of these companies and brands and organizations are solving for are large scale issues. So I'm right there with you.
Yeah, good.
Yes. And I think just being able to have, you know, your perspective as, you know, someone that is able to kind of, I think it's kind of cool where you're able to also have your pulse on what's new, what's happening, right? Kind of within the medical device space or in all these other areas. Do you kind of have any insight as to like, what are some of the trends that you're seeing? What are some of like the areas of opportunity when it comes to not just maybe devices, but, you know, areas where there's getting a lot more saturation of, you know, products or things that can help it?
Yeah, so there's been a lot of buzz lately, thankfully, about menopause. There's a lot of talk about sexual wellness. Again, thank goodness. Again, it's not a taboo topic. Thankfully, cancer has always been top of mind, but now cervical cancer is becoming a really big, important thing. And so those are the things like that are already being talked about. I think now, and mental health, everyone's starting, you know, we're finally starting to talk about, and care for women around the world. So, you know, making sure that women postpartum and, you know, like, it's not just about the baby, it's the woman who actually goes through more changes than anything else. And so let's take care of that mother. And, you know, because she, again, is providing for her whole family and she's taking care of everybody. So like, those are the trends that are like, you know, like that everyone's really, really focused on right now. I think in the future, it's going to be a lot of talk about how to make connections and like how to connect what's happening and what we're innovating into like a smaller scale and into a more, again, talking about digital health, like making it more digital and portable. So I don't think digital is just like an app on a phone. Like it also needs to be portable. So, you know, handheld ultrasounds are becoming far more popular. You know, what else can we miniaturize and not have maybe these bigger centers of care, and maybe it's like mobile centers of care. And again, this is not just like a rural, you know, solution. Like, I mean, like I'm in New York City, like I pop onto the mobile COVID-19 bus that's like running around to like, you know, swab my nose. Like we can create solutions like that, that's actually like full care. Absolutely. And so that you don't have to disrupt everybody's day as well. So you can be in the community, and especially for communities that don't have access. And so that's one of the bigger trends that I'm seeing coming out as well, is like access to care where the patients are, where you are. And oftentimes, like, obviously, you know, in the next few years, I think they said 65% of the world's population is going to be in cities. So obviously things are very concentrated, but you know, the cities keep growing. So you got to go out into the, you know, into the suburbs. And there's also like an overburdening of our healthcare system and our hospitals. So how do we unburden? And I think like that's a lot of the future, and like creating workflow solutions that makes, you know, doctors faster, more efficient, give them tools so that they can make better and faster, more informed decisions, because that's where you can like tie in precision medicine. So again, you can be healed faster if, God forbid, you know, you need it.
Absolutely. No, I love that. And I think being able to kind of see just this big ecosystem change that is kind of starting to happen, I think is really, really reassuring. especially since I think when you were talking about, and I also see this too, like the mobile clinics and things like that, I think it does help to kind of almost normalize it, because I would say like there is a huge access thing, but I think there are so many other barriers that kind of prevent people from going to that traditional large center hospital. So to have it in a parking lot at a park, I think also just really makes it so much easier to be able to access it that way too. So we love to see it.
And to have it like in your hands. I mean, 83% of the world has a cell phone. So,
absolutely,
utilize that as an initial screening or whatever, you can do on the digital health side. And then you're strategically putting people into the clinic or into the doctor's office instead of having everybody show up.
Absolutely.
And this is the use of technology, and there's things that we can do at home that we're far more comfortable doing at home. Like I'd rather do a pap smear at home, than my doctor. Why does she need to do it? She doesn't need to do it. I could do it.
I love that. I think there's so much that can be done with technology, especially when there's like intentionality and like design, and like a lot of that has been thought through, which I think we're definitely headed. So it is really exciting to see, just all of the amazing work that's being done. And I think companies like yours also just go to show that, this all kind of exists within an ecosystem that all kind of supports and collaborates with each other, which I think is always incredible. Exactly. And I know we're at 2 minutes, so wanted to wrap up with my favorite question, which is, do you have any words of wisdom or any advice that you would like to share with our community, either just career advice that you've kind of learned or anything that maybe a mentor has told you that you want to share with us?
Yeah, I mean, I'm very much, as an engineer, like, I like to solve problems. And I think there's a lot of people who want to do that. So like, if you see a gap or a market that's not being served, create a solution or find a solution or do something, and don't think like I have to be an entrepreneur. Like everyone doesn't have to be an entrepreneur. You can do this inside your company. You can do this, individually. You can do this as a side hustle. You can do, and I'm not saying like everybody has to be an engineer, no, but if you see a problem, try to find a solution. And, like that's kind of my advice, like, and just do it, like, just try it. Again, I'm able to say that to, I can always go back into corporate if I want, or you can always get another job, and, things like that. Like we're in a privileged, position, but if you find something that is wrong, then fix it, or work to fix it, or find somebody who can fix it. Right. And, like take action, be bold, speak out, say something. Like there's no reason that you shouldn't. Like there are many protections, thankfully in this world that can protect you. And if you see something that's wrong, like, or if you see something like, hey, why are there no women on this design team? Right. Ask about it, or ask to be on that team, or talk to a friend who maybe could be on that team, or, something like that. And it's not, it's not protest with a sign or anything like that. I'm not saying, everyone has to do that. It's take small steps, like, stand up for the woman who's, who's not being spoken to or not included at the table, or all of these things. Like bring her next to you. Like that's what we can do, because otherwise everything just stays the same. And we all know like that's not good enough. Yeah. So I love that. I absolutely love that. Speak up, invite women to be a part of the table. Like I think all of that is incredible. And I like that you kind of were talking about it at whatever level that makes sense for you, that you're comfortable with, like that's still a start. That's a step. So that is amazing, amazing advice. Thank you so much, Marissa, for taking the time to chat with us today. What an incredible discussion. I personally learned a ton that I will now share with people that I know, just these stats. So really appreciate you taking the time to chat with us today. Thanks so much. Well, everyone, please make sure you check into our session next week. We'll be bringing on another amazing guest. I also wanted to remind everyone about the summit that is happening at the end of the month, as well as the Breakthrough One Alliance membership. So all of that amazing information is going to be in the chat. Please be sure to check both of the program and the event out. Wanted to give a shout out to our sponsors, Goodwin and Witham, for sponsoring this conversation, as well as one huge shout out to Marissa for a very insightful discussion. And I will see everyone next Wednesday. Have a good day.